In this presentation, we will discuss the legal, ethical, and social implications of the Tuskegee study of untreated syphilis in the Negro Male. Let's have a brief look at the history of the study. In 1932, the U.S. Public Health Service began a study to document the progression of untreated syphilis. They recruited 600 poor African American sharecroppers from Macomb, Alabama, 399 of whom had the disease and 201 who did not. The participants were told the study was examining, quote, bad blood. This was a local term used to describe everything from syphilis to anemia to fatigue. In exchange, the participants were given free medical treatment, meals, and burial insurance. Despite the fact that by the mid-1940s, penicillin had become the treatment of choice for syphilis, none of the men in the study were treated. In 1972, the first news article broke the story about the study. The Department of Health and Human Services appointed a panel to review the study and found it to be ethically unjustified, thus ending the study. In 1973, the panel instructed the U.S. Public Health Service to provide all necessary medical care to the survivors. Thus, the Tuskegee Health Benefit Program was initiated. Additionally, in 1973, the survivors filed a class action lawsuit resulting in a $10 million out-of-court settlement for the participants. Later, in 1975, the participants' wives, widows, and children were added to the Tuskegee Health Benefit Program. Finally, in 1997, over 60 years later, President Bill Clinton issues a public formal apology to the participants of the Tuskegee study. So, what are the ethical issues violated by the Tuskegee study? First and foremost, we have informed consent. The Tuskegee participants were never informed of the true nature of the study, thus could never give consent. In relation to the concept of informed consent, we have autonomy. Without informed consent, one cannot make one's own informed decisions, thus violating the ethical concept of autonomy. Beneficence and non-maleficence. These are interrelated. Beneficence means we do good, while non-maleficence means we do no bad. Withholding treatment after the fact violates both of these principles. Withholding treatment then also disregards the ethical principle of duty to care. Last, there's justice. This principle deems we be fair in the distribution of benefits and risks. There's no doubt in this case justice was not considered. So, knowing all of the ethical issues that were violated, what are the social implications of the study? The concept of peripheral trauma is broached in an article titled The Tuskegee Study of Unrelated Syphilis, a case study in peripheral trauma with implications for health professionals. Peripheral trauma is defined in this article as racially or ethnically targeted events that may have adverse health implications for members of the group that were not directly targeted. What does this mean? Well, between 1973 and 1977, African American men decreased their interactions with healthcare providers by a full 22%. Nearly 50 years later, many African Americans still have a mistrust of the healthcare profession. Take, for instance, the COVID-19 vaccine. Only 57% of Black Americans had received at least one vaccine dose as of April of 2022. Compare this to the 63%, 65%, and 85% of white, Hispanic, and Asian Americans, respectively. This resulted in a mortality rate that was a third higher than Latinos and more than double that of whites for African Americans. So, how can we mitigate the effects of mistrust of medical professionals in the African American community? For starters, the need for cultural competency training is paramount. However, even with excellent training, sometimes the gap just can't be bridged. In these cases, the only answer could be an increase in diversity of healthcare providers. In a 2018 study, that randomly assigned Black males to physicians of different racial backgrounds. Black male patients were 18% more likely to consent to preventative treatment when assigned to a Black male physician. So, 90 years after the start of the Tuskegee experiment, where have the process improvements gotten us today? Let's start with informed consent. What is it? Informed consent is a process by which a healthcare provider educates their patient about the risks, benefits, and alternatives to a procedure. No procedure can happen without it in medicine today. What are the aspects of informed consent? In addition to the explanation of the procedure and the risks and benefits, a patient must have decision-making capacity. They must be able to understand the information given. If not, a designated person can do so for the patient. If a person later becomes competent to make his or her own decisions, they can then decide if they want to remain in the study. The National Research Act of 1974 created the National Commission for the Protection of Human Subjects of Biomedical and Behavioral Research. One of its initiatives was the creation of institutional review boards, the purpose of which was to protect the welfare of research subjects. An institutional review board has 7 criteria for a study to go forward. 1. Informed consent will be sought when appropriate. 2. Informed consent will be documented when appropriate. 3. Measures are in place to protect the privacy and confidentiality of research subjects. 4. Risks are minimized. 5. Risks are reasonable in relation to benefits. 6. Data will be monitored for safety. And 7. Selection of subjects is equitable. According to the IRBs, meeting these criteria means the study is justified in relation to respect for persons, justice, and beneficence. After this review, an IRB has 4 choices it can make. It can approve the study as is. Secondly, it can approve the study with modifications. Third, it can table the study to be reviewed at a later date. Or lastly, it can reject the study outright. Now, let's have a look at the Belmont Report. It was also a result of the 1974 Research Act. The Belmont Report lays out specific rules and guidelines to be followed by researchers conducting studies on humans. It identified basic ethical concepts that should be incorporated into any research done with human subjects. These include beneficence, justice, informed consent, non-maleficence, and selection of subjects. All of these can then be related back to the 7 aspects institutional review boards must adhere to. In conclusion, after atrocities like the Tuskegee experiment, there naturally is a mistrust of the healthcare profession in marginalized groups. We have come a long way in mitigating those misgivings. The implementation of institutional review boards and laws regarding medical research have come a long way, but we still have work to do if we're going to bridge the gap in healthcare equity. Thank you for your attention to this important topic.